All right, I think we can go ahead and get started. Um, Thank you so much, everyone, for hopping on to the Forte site call. We have these site calls on a quarterly basis, so of course we're having this today, and we are very excited to host VisionTree to do a training and also answer any of your questions about, helping your participants complete their QOLs through the VisionTree software. I'm going to go ahead and do a couple of announcements to start. Sheena, thanks so much for hopping on. If you want to go ahead and get your slides or anything like that ready. Please feel free. I'm going to go ahead and just give a couple of quick announcements related to big things that we have going on with Forte. The first big one is if you didn't see the couple of announcements on the energy broadcast list, the FedEx account for Forte has been closed. So if you have any outstanding air bills related specifically to the blood collection kits, please reach out to the Energy Biobank and get new air bills for that. If you try to mail them with the existing air bills that belong to the old account, that will cause a lot of hiccups and a lot of challenges once these are dropped off at the post office. So please reach out to the biobank with any outstanding air bills. You basically just reach out, let them know how many you have, how many air bills you need. They're more than happy to send them to you. I'm going to pop the announcement into the chat as well so that you're able to see the contact information listed for that. And this announcement was released on Forte Fridays and as a special broadcast. So if you aren't getting those, I can also put information in the chat about how to sign up for those broadcasts. So that's a very big announcement for sure. If you haven't already signed up, Forte is hosting Dr. Jeffrey Duker, the Forte Protocol co-chair next week, next Tuesday on May 20th, which is also Clinical Trials Day. We are hosting him to do a Polyp 101 webinar where Dr. Duker is going to share the Forte co-chair's perspectives on eligibility screening for polyps related to energy CC005. So if you haven't already signed up, I know a lot of people have, but yes, that information can be found honestly a lot of different places. I think Forte Fridays, we've also popped it in the energy newsletter. I think it's also on the Twitter account at this point.
Can
So
I interrupt?
Yes, please.
For those of you that are on that do oncology clinical trials, myself included, polyps sometimes get me all turned around. So I am constantly asking Dr. Duker and Dr. Schoen, is this patient eligible with this polyp? And I think they're thinking, Kristen, come on, you should know this by now. But I've done colon cancer for so long. Polyps are a whole different world. So we're really excited Dr. Duker is going to do this because I think it's going to help those of us that have been in oncology a long time kind of learn what is eligible and what isn't. So sorry to interrupt, Cheryl. I'll go back to quiet.
No, please. That is very helpful. I'm also not a nurse, so I'm going to be going into this like completely with fresh eyes as well. Um, the last one is just to let you know that the energy meeting, of course, is coming up in July in DC. And so if you're interested, please feel free to go on the energy website and register for the sessions there. Forte, we will be hosting a roundtable at the PSC roundtables on Thursday afternoon, and there will also be a quick presentation at the NCORP Town Hall that are Forte related, but of course, many of you are involved in multiple trials, so do check out the agenda and see what would be relevant to you. Those are like the big announcements that we have today. And so I think at this point, we'd like to turn it over to Sheena, who is here as a representative to VisionTree. So thank you so much for hopping on, Sheena.
Yeah, good afternoon, everyone. I'll turn my camera on briefly just to say hi, if it works. Yep. Good afternoon, everyone. My name is Sheena Ga. I am the head of customer success at VisionTree and your main point of contact for all of the energy or TOG studies. So we typically I have slides. I don't know. I know we're a smaller group. We do have monthly webinars. So you feel free if at any point you need a refresher that you can hop on and those have the slides and everything. I thought for this group, I could just go directly into the software and then answer any questions there if that's helpful. So we can dive in and do that and have it specific to the Forte study. So perfect. All right. All right. So hopefully all of you have had experience with VisionTree, have had access to it. As you know, we don't grant access unless you have a patient who's actually consented to use VisionTree. So until you have a patient, your site might be participating, but until you have a patient who's consented, then you'll get granted access. If you do have a patient and you haven't, feel free to reach out to our support team. You can always reach out to them by here clicking contact support. Our email is just support@visiontree.com, so super easy to remember. But patients and care team members would log into rtog.optimalcare.com. Again, you could just click patient sign in if you're a patient, care team sign in for you all. And you're going to enter the username and the password that my support team has provided. If you forget your password at any point, you can just click forgot password here, or again, email my support team and they're pretty quick. And we'll get back to you ASAP with that password. And so once you log in, okay, good. I'm on my demo site here. So once you log in, you'll be taken to our homepage. Now, if your site is participating in other studies outside of the FORTE study, you're going to see patients from those studies there. But these are only going to be site-specific patients for you that you'll see site-specific to your site. And so all of your patients will be listed here. If you're new, your site's new, you might not have any patients. So the first thing you'll want to do is click Create New Patient up here. So you're going to click this Create New Patient button. You won't have this site filter. I'm on a admin level here, so you wouldn't have to find your site or anything like that. You're just going to enter the patient's first initial, middle initial, last initial, and their email. Email is super important because we send automated email reminders when their forms are due. And then what you're going to want to do is apply the patient template. So again, if your site's participating in multiple studies, you're going to see those templates listed here. Because I'm at like an admin level, I see all of these templates. So you're probably going to see a very abbreviated list of this. So, it might be one study or might be a few. But you're going to go ahead to the FORTE, which is CC 005. And of course, here it is. So you're going to click on this and apply this template. So what that does is it applies the forms and the follow-up forms that are part of the study, right? So when you click it, it's going to default to today's date. You do want to change that to the patient randomization date. So whatever date that is, you can just click in here. It always defaults to today's date, so just know that. You'll want to click on here and make sure you change it to the patient randomization date. I do have an option to edit that later if you forget at whatever point, so I'll show you that as well. But let's just say this patient randomized on the 5th. I'll go ahead and put the 5th here. And then you're going to want to click the research study. So again, only studies that are visible to your site are going to be shown here, not this whole list. I'm going to go ahead and click CC 005. And then you're going to want to add the patient's case number. So it's very specific. You're going to have the CTEP ID -CC005 -5-digit case number. Let me see if I can just use this example. Something like this. And then that should, oh, I forgot everything else. Just one second while I throw in some stuff in here. Okay, then you can go ahead and click create account. Okay, just kidding. I need a unique ID. Hopefully that works. All right. So you've created the patient's account. You can go ahead and close out of this and you can go back to the home, which is up here on the left hand top corner. Click home, and then you can find your patient. So you can either search by last initial, first initial. Can't remember what this way. And since I have this could be it. Yeah, today's 14th. Okay. So we'll click into the patient's record. The patient, if you know you're in that patient's record, if they're highlighted blue here, so I'm in this test patient's record that I just created, you can see all of the FORTE questionnaires here. If you notice, so this is the active range, right? So you'll see, okay, this form became due on May 5th, and then it expires on August 3rd. So if you're looking at these dates, you're like, oh, I actually think I might have put that date in wrong, the randomization date. You can always go back up, click Edit Patient's Dashboard right here, and you can change this date. So let me show you, let's say, oh, actually, they just randomized today. We're going to go ahead and change it back to the 14th, and you'll see these dates right here switched. So now you'll see it's a preview once I hit save of what the active from and active to date. So this form becomes active and available for the patient to take on the 14th today, and will expire the last day for them to fill it out on the 12th, August 12th. So I'll go ahead and hit save, and we'll go back to my patient right here. So you'll see those dates now updated. Looking at this patient dashboard, so a couple things to note. The status column right here, active. If it's green, that means it's available for the patient to take. So if they log into their portal, they should see that form in their portal to take if they're, if they're actively logging in. They do get reminders. I'll show you what the reminders look like, but they do have a passwordless link in the reminder. Also, all the patient needs to do is click that link when they receive those reminders. It takes them to a page that asks them to verify their first and last name. First and last initial, and then they're taken directly to their forms. So it makes it super easy for the patients to access their forms. They do get weekly reminders until the forms are completed. So this patient would continue to get reminders until they've completed it until August. So one thing to note there. Again, you'll see the form names here, the templates. Of course, you want to make sure you've applied the correct template. We went over the active range and then the progress. So not started, the patient hasn't completed or even started the forms yet. There is in progress. So maybe the patient has started the forms. It could be a longer form. And maybe they're like, hey, I'll get to it later. So you'll see in progress. And then the other one is completed. So obviously if it's completed, that should show in Rave. So you should, if you see progress completed here, you should be able to look in Rave and see that those questions have transferred over. If they don't, for whatever reason, sometimes there's a glitch. Sometimes there's an issue with the case ID, which is actually mostly what it is. Let my team know, and we can always look into that. We do get notifications of when forms go into Rave successfully and when they aren't successful. So if there's ever an issue with maybe the case number and we're not able to figure it out, we'll reach out as well to the RA or to the FORTE team directly. And then the last edit is going to be just the day that it was completed. If they, for whatever reason, go back in and make any changes, you'll see that date change. But typically, it's usually just the date that they completed and saved the form. There are a couple options for you under here. You can edit the form. So if you have the patient on the phone, maybe it's an elderly patient, they're not completing it or they don't have access to computer, you can always click edit form here. That brings it up for this patient and you can physically read the form if you needed to get those answers and go ahead and answer the questions here. I feel like this one had some required questions in it. Let me double check. Let me find maybe another one. Yeah, okay. So again, we could go in, fill this out on behalf of the patient. If that's something you need, to do for your patient. I'm just going to fill this out so you can see what it looks like when it's been completed. We'll go back to my patient here. You'll see last edit date, and then now the status is completed. And this technically would go over to Rave if we were on a production, right? And this was a real patient. This little hamburger icon here, these 3 lines, you can actually view the form. So if you needed to just view it, maybe you're looking in Rave and you're like, hey, these questions are blank. Did that patient actually fill it out? You can go back in, you can just view the form and see maybe the patient didn't fill out those questions and confirm that it was skipped, right? So that's a question that we do get. Hey, I see that this is blank in Rave. Can you confirm it was actually purposely skipped? You can see the history. So this gives you a CSV file of the history. So again, in an Excel format of just what the patient had responded. What this is useful for is if they've actually edited the form. So if you needed to go back and go, hey, I knew you completed on the 14th, but then I look and you've updated it on the 30th or whatever, you can go in here. The first line is going to be the initial line, and then there'll be a second line here showing what was changed. So, it might go from good to very good or something like that. So you can kind of just audit or track what was changed if they did. Again, not something you'll probably use a ton, but is available. And you won't have these options, so you can ignore those. And then what else can you do here? Oh, why can't I click out of this? Let me just refresh for a second. And then another thing that you all have the option is kiosk mode. So I don't know if you've used it. Kiosk mode is if you have your patient on site with you, they haven't completed their forms, maybe they're coming in for a check-in, a follow-up appointment, and you're like, hey, I noticed you haven't completed this forms yet. If you have a tablet, if you have like an extra laptop lying around, or if the patient has a smartphone and is tech savvy and they can figure it out, you can click kiosk mode. So let's say, hey, they have, they came in, they have 10, 15 minutes before their appointment. We're going to have them try to fill out this questionnaire before they go in. You can click the questionnaire, or you don't have to click any. It will just default to any forms that are not started and active. But let's say we want the patient to fill out this form. You're going to select the form, and then you're going to click kiosk mode here. So what that does is you can launch it on a separate device. So again, if you have, like you're using the tablet that you're going to hand the patient, you can have them launch it on this device, hand them the tablet, or if you have the patient in front of you, you can have them scan this QR code. They can use their cell phone to scan the QR code. Let me show you. It's going to log me out, but let me show you what it looks like. So this is my laptop. I'm going to hand this laptop to the patient. Now, when I click launch on this device, what it does is it actually logs me out in the background from here. So the patient cannot go back in, can't see any other data, anything like that. If I try to even click back, I think it's going to take me back to the login page, right? So it physically logs you out. This is the kiosk mode page. The patient would enter their first and last initial. I can't remember which way I went. Let's see if this is right. This link is specific to the patient. So if I get this wrong, it's going to throw me an error, right? This is also very similar. I mentioned how patients get an email weekly. This is pretty much the exact same page. It just says fast track at the top. And so this is how the patients would log in from home when they get those emails as well. Let me start forms. Yep. Okay. Other way. Why? If this is the patient's first time logging in, they're going to see this data privacy and security policy. It's just standard text verbiage. Some patients reach out, ask us about some questions they have. We are fully prepared to answer any other questions they have about data security and privacy. But it's pretty standard language here. We ask that they allow. So if I try to just say yes to accept it, it's going to go back and say, can you please allow communications? If you've entered the patient's email address and they go in and they say block communications, no matter what, they're going to stop receiving email reminders from us. So just something to note. I'm going to hit allow, but the patient can go in here and block communications. So you do want to make sure that they are aware that they're going to be receiving reminders from us. You can get a verbal consent from them as well, and I'll show you how you can consent on the back end for them, but hopefully they hit allow because that obviously gets them reminders weekly to fill out their forms. We're going to go ahead and say I've reviewed and accepted. All right. And then your patients are going to be taken directly to their form. This is mobile responsive. Okay, let me move that here. So I just wanted to show you all that does fit to your patient's device. See how it kind of molds to it. So it is a mobile responsive form. You can see here that we do have it also in Spanish. So if you do have Spanish speakers there, just know that they have this language drop down at the very top right of the form where they can select their language. They'll go through, complete their form, and hit submit form. And if they have multiple forms to complete, as you remember, I clicked just one, it'll actually take them to the next one. So it's wizard driven, which is nice. So again, super easy for the patients to access their forms. Let me go ahead and just log right back in. And while I'm doing that, let me see if there was any questions. I saw something come in from the chat here. Oh, okay.
Yeah, Sheena, I was just going to read them so we have them for the recording as well. So Madeline said, if the patient has timed out of their active range, do we mark them as not completed, or are we able to resend it within a new active range?
That's a great question. I think that's up to you all, right? The Forte group. I don't know if you guys are we were able to change it on our end. But I do know some studies are very strict in how what I guess the range that they need it completed.
Yeah, absolutely.
Yeah.
I think we have, I think I saw Isabella, who's the Forte data manager, on here. Isabella, would you be able to chime in on that?
Yeah, so forms in VisionTree will stay only open in the range that we provide. If they were not completed but can be completed after, they would have to be completed on paper.
Gotcha. Okay.
Thanks, Isabella.
I believe this will be clarified in the amendment.
Perfect. And we typically get those questions too. We do direct them to the sites or well, what is the word? I'm sorry, I'm dealing with a cold right now, so I'm like half. But the RTOG NRG folks will direct you all to them just to make sure, because we don't want to answer on behalf of you all. Perfect. Great question, though. We do have, but we.
Another...
Oh,
please go ahead. I have another question from Joanna. With the new protocol allowing up to a year to complete the baseline questionnaires, should we reset the active range? Isabella, what are your thoughts on that?
In VisionTree?
Joanna, would you like to unmute and clarify maybe a little bit more detail on what you're asking? That'd be really much appreciated.
Yeah, I think I noticed with the new protocol that we're now allowed to like complete the baseline questionnaires. We're allotted up to a year. Some of my patients, like I've had to call them to kind of remind them, and they're able to do it. They were able to do it after the 3 months, so I reset their VisionTree and they completed it. But I know you said we're supposed to do it on paper after 3 months. Is that still the case since the new protocol says we're allotted up to a year now?
What does it say in the protocol?
I would have to look at it now to say specifically, but I think in the new one, it just had mentioned how patients now have like up to within the first year they could complete those questionnaires. It doesn't really specify about VisionTree or on paper.
I believe we are working on a protocol amendment, and I think this is, if I remember correctly, this is clarified in the new protocol amendment. The paper statement.
Yeah, I think it says that it's preferred to be collected within the 3 months from randomization, but it could be collected up to a year after.
Correct.
So, I guess if they're not able to do it within the 3 months as preferred, then we need to do it on paper within that year?
Correct.
Okay.
All right.
And
that's helpful for me to know as well.
Grace, I see your question. I thought it was stool and blood for a year and 90 days for the questionnaires. I think what we're referring to here is Protocol Amendment 7 that was activated in January. I'm looking at it right now, and on Table 1, Footnote C, it says participants will be asked to complete forms related to demographics, family history, health, diet, and lifestyle factors. It is preferred that the questionnaires be collected within 3 months of randomization. So that is the 90 days comment. But questionnaires collected after that time, up to 1 year, should be submitted. And so that's what we're referring to here.
If I remember correctly, it's 90 days. And then there's plus 15 days, because that 15 days is whenever they are due. So after 90 days, they become overdue. So overdue is for 15 days. So it's 105 days total.
All right.
And to confirm, footnote D does say that the baseline blood-induced samples would be collected within 1 year of randomization, but samples collected after that time should still be submitted. Sorry to hijack your comments, Sheena, but please continue.
No, you're totally fine. I just was double checking something. I think we might have changed that. We have 90 days here. I want to say on production, it's probably so it should be 105 days. Is that what I'm hearing?
I thought
Isabella?
it was 105, but let me double check on this.
I'm going to double check.
You know what? Wait, this is Kristen. The protocol states that the CCO5 Pro questionnaires will be completed within 3 months after the participant has been randomized on the study. But questionnaires completed after that time, up to a year, should be submitted.
Correct.
So we're saying 3 months is when they're due, but we will take them up to a year. So should we leave VisionTree open longer?
I think this was something that was discussed internally lately. I don't know if you were on those emails, Kristen.
I'd have to look.
I do remember you all reaching out to me about that. There was an internal, I don't know what the outcome was, but I do remember we didn't end up changing anything. So it almost sounds like.
Isabella, you and I can talk outside of this.
Yes. And I will get back to you, Sheena, about this additional 15 days.
And you're fine, Isabella. I just checked on production. Again, I'm on demo here. It is 15 weeks, which is 105 days on production. So it does include that. So I did update that. So all your templates on production will be 90 plus 15 days. So sorry, I was just double checking that to make sure, because I do recall making a slight update. Sometimes I don't also do it on demo since we don't necessarily have to play with it once it goes live, right? Okay. All right, let's go back to my patient here.
We'll discuss this issue internally and definitely send an update out probably through Forte Fridays about where the VisionTree stands with what window you have to have patients complete their questionnaires.
Right. All right. All right. So we went over this. Okay, let me go back. Okay, any questions specific to the patient forms tab here, kiosk mode, editing the template start date, anything like that before I move on to the next tab? Okay, all right, moving on. So again, I think this was everything here that's important. We go to the overview tab. A couple of things here. First initial, last initial. If you messed up in any way when you're creating the patient, you can do edits here. If the email address that they provided was wrong, or they updated their email address, you can check it here. Something that we get a ton of, well, actually no, because you guys have the location ID in your case ID. So actually you guys are fine. We have other studies that don't have this included, and that's where we get a ton of errors. So actually you guys are all good with that. So we don't have to worry about that. The one thing I will notice here, patient consent to email. If this is clicked to not consented, let me just show you what that looks like here. You'll see that the overview tab is going to have this red dot in the top right there. That's going to be an indication to you. So if you go to your patient and you see that, that's an indication to you that they have not consented to emails, or they went in and they denied consent to it, and they're not receiving email reminders. So just a note to you there that you might want to call the patient, ask them if they've purposely unconsented to receive email reminders, maybe ask them if they want to and get their verbal consent, because you can go back here and actually consent them to it. But that's just kind of a red flag, that they aren't receiving email reminders. They also have the account activity here, so you can see if a patient's actually logged in, if they've done anything with their portal at all. So if you see nothing here, you know that the patient hasn't been engaged with their portal. And then down here in the communication log, you will see email reminders. So of course, I created this patient today. They do get an automated email reminder automatically when you first set up their account that has their login card info, which would take them directly to that page that I showed you guys earlier, right here where they would log in. So it wouldn't be passwordless. They'd have to enter their first initial, last initial, and then the temporary password that's provided. But that we do send them this email. This email gets sent regardless if they've consented or not, but the follow-up emails, those reminders, do need their consent. So again, you do want to just make sure that they have consented to receive emails. And again, you can do that verbally over the phone with them and consent them via the overview tab here. And then so it's kind of nice to see this, because if you're saying, if your patient's like, hey, I haven't gotten any emails from you all, you can say, actually, you have. I see one sent on, the 14th from this email, and that, maybe they can check their spam. That's one thing where it goes. I will tell you guys, I've noticed Yahoo emails in particular have issues. It's nothing that we can do to prevent it. But Yahoo emails, I think, block, because we send email reminders out like on a bulk basis. Because you imagine we have other companies as well. We're sending all these email reminders to patients, let's say 9 a.m. every day. And I think Yahoo just does something where they block the email address. And it's not anything, we've tried to reach out to them. It's nothing we can do. So Yahoo emails are a little bit troublesome. So if you have a patient who has a Yahoo email, isn't seeing it, see if they have another email address you can get, just so that they're not having any issues with that. So account activity here, communications log, and then you can also view what was sent to the patient as well here, just if you wanted to see the text. But it's kind of helpful if you're communicating with the patient. We're going to skip over patient reports because that's not been set up. But perform action. So here, if you need to send that login card, which again has them email, not email, have them log in directly to their patient portal, you can resend that to them. But really, I think what's important here is the send fast track link, which is exactly the same thing as the smart reminders that they get weekly, but you can actually send it. So again, if you're calling them on the phone and they're like, hey, I'm not getting an email, you can say, okay, well, I'm sending you one now. Can you confirm if you've gotten it? So you can just click send fast track link and hit OK, and I'll send a fast track link to the patient. So if we go back to the overview tab, I should see, oops, this one right here. And again, we can see the text here. So this is a passwordless link that they would just click on and then go to that page where it just asks them to confirm their first and last initial. So yeah, so that you can actually see where it's from too. So then maybe ask them if they are having issues to unblock or add that email address to their email if that's an issue. I think with Yahoo, just to note, if they don't have a different email address, adding this to their address book actually helps prevent the blocking issue that we've experienced. So, all right, that is the overview tab. Any questions here? Okay. Other thing I wanted to show you all. I did want to say, okay, so we do have our templates all up here. You don't have to mess with the templates. Like I mentioned, everything's already created for you. So we've set those dates out on production. It's 105 days. So everything's created for you. You can ignore this. You'll see it. You can ignore it. I do see sometimes sites go in and add their own templates. Maybe they're just seeing it going, hey, how do I add those forms? it should be here. You should be able to assign it. If you have a patient and maybe they have the wrong template assigned, again, you can always just go to edit patient's dashboard to change that. But another, where is it? Form compliance. Okay, so forms compliance here is super helpful. You can use this tool to kind of just say, okay, I need to see all my patients who have forms coming due this month who haven't completed yet. So if you wanted to use this as a running list, you can kind of run this monthly, since you guys do have a bit of a big window here, if it's 90 days or a year, whatever. It is, your patients do have some time, so you could run this kind of monthly, the beginning of the month, and go, okay, who has, forms coming due, whose forms are expiring at the end of this month. So let's, again, some on my demo site, this might come out a little funky, but let's try it. So you can select the template here. So let's say I only care about my CC's 005 patients. I want forms that expire within the last 30 days. You do that here. I want forms that have been not started or in progress, so they haven't been completed and they're still active, so they're still available for the patient to take. Let's click generate report. Okay, just as I presumed, there was nothing. Let me see if I can just try this with a different study. The joy of using demo. Okay, here we go. So let's pretend this is EC005. So you'll see here, here's my patient, there's their forms due, and this is how many days they have left before that form expires. So you can actually export this list. Your list might be bigger, it might only have a couple patients, but something that you could use on a monthly basis. Let me move this thing. Let me show you what that looks like. So you can use this as a running list. Okay, well, that didn't help. I don't know why this is blank here. We're going to skip that, but it does export. Or you could be taken directly to their form here. So you can go to the patient directly. I'm going to open this link in a new tab. Here, so we can see this patient. They do have an email. You can go to the overview. Let's see if they've been getting email reminders. Looks like the last one is from the 17th for whatever reason. Or you could go directly to their form here by editing, clicking that little pencil icon. Again, if you have them on the phone, you can read out the questions if you wanted to spend that much time on the phone with them, you could. So yeah, so this is a really helpful tool. Of course, with real data, I'm sure it'll be a lot more, you'll probably get a lot more use out of it versus try to find something on here. So yeah, any questions here so far? Is there anything you all want me to go over specifically or anything I missed? I feel like in terms of managing your patients, these are probably the tools, the forms compliance and then the My Patients tab here, that you're really going to be utilizing. All right. Cheryl, was there anything else you could think of?
No, this was absolutely perfect. Thank you so much, Sheena. Are there any
Of
other
course.
questions related to VisionTree? Please feel free to unmute yourself. Kristen and I, we like to keep it casual and we like to have a lot of conversation during these site calls. So, well, if there's no further questions about VisionTree, we'd definitely like to open the floor to questions related to other parts of Energy CC005, whether that's, of course, screening, enrollment, data management, anything like that. I see Grace has a question. Is there a help doc on how to input information into CTSU to get paid for patient visits at the different sites? That's a good question, Grace. I don't think we have a specific document for that. I do know I've heard from Isabella in other conversations that in a lot of these cases, once the information is keyed into Rave, that kind of gets automatically pushed to payment. Isabella, is there anything more related to that? I know we've had this conversation before.
Which biosamples?
I'm not sure if there's a specific, so I'm wondering if maybe you could clarify which ones are the more are automatically pushed for Forte.
Into RAFE, yes.
Yes, into Ray for payment purposes.
Stool samples.
Okay.
But sites are being paid directly from biobank for both samples, stool samples and blood samples. This information doesn't go into open.
To my understanding, Grace, and I'm definitely going to ask Kristen and Isabella to chime in on this. To my understanding, with the blood samples and the optional specimens, to my understanding, once the sample has been received, that then gets pushed internally and you will receive payment. You know, it does take time. Of course, we have to receive it. We have to catalog it. The biobank has to do its part. But it's an automatic payment system, to my understanding. We've had that discussion. And then I see another question. What additional information are we to be putting in CTSU after we completed the first year specimen collections and questionnaires? Do you mind unmuting yourself and clarifying? I'm a little unclear on additional information you're referring to.
We had a call earlier on our site, and one of the senior coordinators was mentioning that we were supposed to be adding in information into CTSU to trigger the payment for the new patient that we're putting into the study. However, I mean, I understood to an extent, but for other NRG studies, I know that the payment automatically transferred after the information is engraved. What you just said, you pretty much said the same thing. So the same thing happens for NRG. But I just want to make sure I'm not missing anything because I mean, you know, we're relatively newer coordinators at this specific site. So I don't know what was stated when, you know, the site, you know, was first launched for FORTE. I just want to make sure I'm not missing a step.
So it's follow-up information. It's follow-up 1, 2, 3, and 4. And I believe there's 2 more biosample information also entered in open.
So we're adding in the optional specimen information into open.
You can see that whenever you go into open and you click on your patient on that dollar sign, and it will take you to the funding sheet. And it will give you all the information that's expected to be entered.
Right. So when I went to the funding sheet, I saw an area where I was supposed to put in like the date. So are we supposed to complete that after we do the specimen collection?
This is not, I don't think there's anything for, there's nothing for the stool sample collection and there's nothing for the blood collection.
Okay.
It should not be.
Okay.
Yeah, my understanding is if it was automatic. If there's something with a specific participant ID, feel free to reach out to the Forte email address and maybe we can look in and maybe there was a you know data like a technical error there if there's a specific issue. But yeah, my understanding is it's meant to be triggered automatically. I see a couple of
answers. So I think she was just responding to what I was saying. So we don't put in information after. We put in the information after the baseline visits, but for the baseline visits, we're not putting in anything.
Someone posted a screenshot, and that's the screenshot. Those are types of information that needs to be put into open.
Okay. Okay, so nothing for the baseline visit. Okay. Okay.
Thanks for clarifying. I see another question from Missy. If a potential participant is found by EMR review and is a patient in the same practice with the PI for Forte, does there need to be the referral beforehand? All the surgeons that work with the PI are willing to let their patients be enrolled to Forte. Kristen, can you take that one?
Yeah, I got it. So if the PI has, okay, for example, Dr. Schoenman's site, Dr. Schoenman, when the study started, sent out an email to all the GI docs in his practice. It's a very large practice covering multiple institutions, and said, are you willing to let your patients be contacted about FORTE? And the physicians that weren't willing sent an email saying no. So if you have kind of an agreement where they, the FORTE can reach out to all the surgeons in the practice, then it should be fine. If all the surgeons that work with the PR are willing to let their patient, I think you're covered because you got permission through the surgeon to reach out to them. I think you're okay.
Yes.
Am I answering
I
you
would
right,
agree with
Missy?
that.
Or am I
Yes,
missing your
yes, I
question?
think so. They all work in the same practice, and so they said that their patients could all go on the trial.
Okay,
So-
you're fine.
Yeah.
Okay.
And apologies, because I left my office and left my laptop at work and had to run back and get it. So that's telling you the kind of day I've had. So yeah.
Oh no. Yeah, in the way that we have been discussing, like Kristen said, if you have discussed Forte with the gastroenterologist at the practice and they have consented to have their participants, any potentially eligible participants referred to Forte, you are good to go there. Yeah, if you need any assistance with working with your clinics to see if they're willing to have their patients be consented to Forte, we've got a bunch of tools on the Forte resource portal. And you can definitely use those, such as, a drafted letter and the GI Society's letter. That's the one that we found to be helpful for that purpose as well. But yeah, Missy, you should be all good to go there.
Okay, thanks.
Yeah, no problem. Any other questions on Forte? We are here to help.
And just as a reminder, we have the Forte office hours too. Cheryl, remind me which day of the month they are. I always forget.
It is the first. Ooh, let me check. I have it written down. I think at this point, with like the third Wednesday being site calls and all that, I'm so confused. It's usually the uh second Thursday of every month. The current month's information will go out on Forte's Friday, so you'll be able to see that particular one. So the next one will be on June 12th at 1 p.m. Eastern.
And the office hours are great because you can pop in, pop out, ask your question, just so if you have something that comes up, feel free to hop on office hours and ask away. It's really, really informal. There's no agenda. It's just Cheryl and I on Teams waiting for people to hop on and ask questions.
So quick question back to the funding. So you said if there's a dollar sign next to the patient, it means it's been paid?
No, that means that there's payments possible.
Okay,
have to
so then we
complete-
have to enter the stuff then.
Yes, and if my understanding of this is correct, you have 1 year from I would call it collection date.
So how can we view what we've been paid for?
What do you mean?
Like, does it post somewhere showing we got a payment for it
Oh,
on
that
there?
I don't know.
From my understanding, that is something you have to work with internally at your site. Because NRG oncology, you're getting paid for NCORP trials, energy trials, like all of the various trials. That is something that has to be figured out internally as a site issue because funding gets distributed, and from that point, there's no way for us to understand where it's been distributed to.
I know that I got questions from a site saying that participants sent stool samples to the biobank and they have not received the payments. And what I advise is to reach out to the biobank because they may be missing some information. That's why the site has not been paid, because first they need to clarify that they have to get whatever they need, the collection date, patient initials, the other information.
But the biobank should be letting us know that stuff is missing, correct?
I think they should, correct. But
Well, I mean,
sometimes if
how
they
are we
don't,
supposed to know
That
if they don't send it?
so so that depends on what information is missing. I will tell you that really simply is you know, if the only thing that's missing is collection date, they can absolutely reach out to us, find out which site it is, and we can give them contact information. They'll reach out to you. But if we get samples that are completely unlabeled, there is no way for us to know, you know, which site to reach out to. There's over 400 active sites with
And
Forte.
Oh,
We're
don't worry about
guessing
it. I
based on
label
states.
the bag
well,
and the tube before it's even given to the patient. So
and
leave nothing to that.
Karen, I can tell you, I get emails from the biobank pretty much monthly where the only thing we have to try and figure out where it goes is the postmark.
Oh, don't worry.
Yep.
My patients, like I said, I label the bag, I label the tube. I don't leave it up to the patient to do that. So
That's good. That's good.
I've
So
worked on,
in your case, if you know, if there's a missing collection date or something simple, the biobank will definitely reach out and
yes.
we can clarify that.
Okay,
But
I
you
was
know,
just confused. You're like, well,
you
if we don't have a way to know. So I was like, okay,
you,
how are we
you
well,
supposed
wouldn't,
to know?
again, it depends. It does depend. Yeah, we get all sorts of things.
Yeah, you
400
never leave
sites,
anything
thousands,
up to
hundreds
the
of
patient
patients.
to have to fill out. Like you should just hand them everything ready to go so they don't even have to think about it. Just put it in the tube, put it in the bag, put it in the box, and give it to FedEx.
and
And
if the
speaking
biobank
of,
has,
oh, please go ahead as well.
thank you, if the biobank has all the information they need, they will send the data to us. And then this will be pushing to RAVE. And this is like we get reports from them monthly. So if you know that the stool sample was submitted 3 months ago and you don't see the collection and receive dates in RAVE, so that's a sign that something is missing.
And actually, regarding this stool sample and talking about FedEx, I did want to share something I've learned recently from discussing with a few of the different sites that are working on Forte. And this is just a tip that you can figure out if this will work for your site. As you know, we talk about it often here at a central location that Forte is being done differently at across the sites nationally. You know, if you're enrolling patients remotely, if you're enrolling patients in person, if you're in a rural site in a metropolitan area, you know, yeah, we have to adapt and accommodate the patients. And as Karen said, you know, make sure that we try to do as much as we can to help them complete their different specimen collections and their different QOLs. So regarding the stool collection, as you guys are aware, the trial, you know, when we created a trial, the stool collection kit was designed to be candid to the patient and for the patient to be able to do their stool sample collection and then mail it off on their own. We have actually been finding that there are a few sites who have found that it is a lot easier if you present the option for them to bring the kit back to you. Um, when the trial was being designed, we didn't have that as a plan because the idea was it would be so much easier if the patient can just, you know, not have to come back and just get to a FedEx location and drop it off. But some patients definitely want some help. They're not sure if they've completed the right forms, if they've filled everything out correctly, and rather than being nervous about it or, you know, having to try to call you, um, you can definitely arrange a time for them to drop it off and then you can review it and mail it off. This is being done at a couple of the sites. I think there's a site in New York. I know the Bay Pines VA is definitely doing this where, yeah, they're calling their patients saying, hey, I see you haven't done your stool collection. I see you have a clinic visit coming up next week. Why don't you go ahead and get it done? And then we will, and you can bring your kit back to me and I'll mail it off for you. And we've actually I've been talking to the sites and there's been quite a few patients that have taken them up on that option. So definitely think it would be something to think about depending on your site. It was a very long ramble, but if there are any other questions, I'm happy to clarify. And of course, we've got a few minutes left and we don't want to run over in case you have other meetings to attend to. So please, if you have more questions about Forte, please feel free to chime in, unmute yourself, pop it in the chat. All right. Thank you so much, everyone, for your time. We always appreciate your time with the Forte Site Call. As a reminder, the Forte Polyp 101 webinar is next Tuesday on May 20th, which is also Clinical Trials Day. If you have any professional social media accounts, I recommend just popping a little something on there to celebrate Clinical Trials Day, as we are all very involved in the world of clinical research. So thank you so much, everyone, for your time. As always, we appreciate it. As always, if you have any questions, please feel free to email forte@energyoncology.org.